Just as a reminder, make sure you have your school ID. If you're going to use a dry erase board, make sure you have that. You will need your two devices. Make sure you have your chargers. In the event that you are needing to take the exam on campus, in the event that you need that exam proctored on campus, send an email to include your campus dean, Dean Darlene Brown, Dr. Tenza, and who's ever course professor that you have in the email, with explanation and your request to take that exam on campus. Just a reminder also that does require a 72-hour notice. So make sure that if that's something that you're needing to do, send that email ASAP with those persons listed in the email. So ethics is what we deem correct or incorrect, right or wrong. It's a set of standards, our moral principles. It directly affects the things that we do or the things that we decide not to do. It is concerned with the way people individually and as a group decide on what is correct or incorrect to do. There are sometimes when our personal ethics and our professional ethics might bump heads or collide, or they might be different. Remember, the Nurses State Practice Act says that it tells us those things that we can lawfully do. But then, personally, we might not think that that's an activity or intervention or a task that we should complete. Personal ethics provide personal guidelines for living. You ultimately choose what your personal code of ethics is, and your personal code of ethics will influence your nursing ethics. Sometimes personal ethics conflict with the law. So again, the Nurse State Practice Act tells us those things that we can lawfully do, but personally, we may think that that's something that we don't need to take part in. So when you decide to or do your job interviews, make sure that you ask for to look at those job responsibilities and tasks and learn more about that facility and all the services that they provide before making that decision to work there. And if you do decide to work there and it comes up that there's an activity or a task or intervention that you personally do not want to participate in, of course, have that conversation with your charge nurse or the supervisor. So we are patients advocates. Remember, we are most of the time we spend more time with our patients than the healthcare providers do. For example, in the long-term care facilities, they're there 24/7. The healthcare providers, they do come in and assess their patients and do those appointments, but they just come in and do that, and then they're on their way. So we're that advocate, we're that go-between, we're the lifeline, all those phrases. So we want to ensure that our clients are getting, having as much information as needed. We talk about consent here in a few minutes. So making sure they have all of those different pieces of information so they can make an informed decision about the health care that they are going to receive. Need to know these different ethical principles. So try to think of examples, non-malfeasance, doing no harm. Beneficence, is what I'm doing going to benefit or do good to this patient? Autonomy, auto. This person has the right to self-govern, make those decisions. They have the right to refuse treatment and interventions. And it's okay just as long as that patient has been given enough information to make that informed decision. Fidelity, being true, that includes HIPAA. Make sure that we're not violating any HIPAA violations. And then justice, no matter what patient, what setting, we are there to provide that best care for that patient. The patient's uninsured, underinsured, the person's non-compliant, the patients maybe, come back to a certain time to receive care when they run out of supplies or things like that. The person may be an alcoholic. It doesn't matter. We still provide that best care for that patient. And that is an ethical principle of justice. So more on autonomy, thinking through all the facts, deciding on the basis of an independent thinking process. Just, that person has the right to self-govern, to make those decisions, and we support them in those decisions. Now, beneficent paternalism, you can think of it as the opposite of autonomy. Autonomy, we're saying, hey, the patient has the right to make this decision about their care. Beneficent paternalism comes in and says, hey, I know the best option for you. It is that type of attitude that what happens is the healthcare provider, what they do is they petitions the courts to the parents or guardians have made a decision about, for the client have made a decision about their health care, whether or not to take their treatment, accept their treatment, refuse it, whatever it is, they have made a decision. The healthcare provider comes and say, well, hey, they really disagree with the decision that they've made. And they think whatever it is, information that they have, I'm sure is evidence-based, but still they think that the person or the patient or the caretaker has made the wrong decision. And so the courts are petitioned to hear both sides. Now, this does not mean that the courts will take the side of the doctor or the parent or guardian. They just are allowed to hear the information. Now, this is not something that is done every day. This is saved for emergency or extreme circumstances. Okay. So remember your Nurse Practice Act. So your Nurse Practice Act, your facilities, policies, and procedures, and their rules and regulations, they pull them out and they format them for their setting, but the information comes from the Nurse Practice Act. Whatever the Nurse Practice Act says that we can lawfully do, a facility makes their rules and regulations and their policies and procedures based on those. So they really do mirror each other. Okay. The State Nurse Practice Act, it defines those minimum competencies that we can perform in our practice. If you have license in more than one state, you do need to make sure that you are doing and following what the Nurse Practice Act says for that state. Because it's not just one Nurse Practice Act for all the states. So you do want to make sure that you're following those guidelines. Okay. So the content of the Nurse Practice Act, it tells us about the continuing education, hours or credits, education that we will need in order to keep our license active. It also tells us about the licensure process and those standards of nursing conduct. So it also tells us information about reasons for a suspended or revoked license. All of this information is in there, the fees that we have to pay. And of course, it defines, the professional nurse. So the State Board of Nursing functions. The State Board of Nursing functions. So it does, it sets fees, it approves the schools of nursing. It you can go and look and see that list of inactive. It keeps all of those files and records. And it does have programs for nurses that are impaired. If a nurse might have, they may have a problem with substance abuse, they do have programs for them. And they rather you seek out their help rather than providing care that will harm a patient. So there are 8 different categories that can result in disciplinary actions. Fraud and deceit, make sure that we are documenting things that are factual. Criminal activity, sometimes patients may have, belongings if they're in a long-term care facility. They bring some of their belongings. They may even have money or some of their credit cards and things like that. And so this criminal activity is someone takes those belongings. Negligence. We have been assigned that patient. It's our duty to provide the best care according to that care plan. That care plan is individualized, but we breach our duty. And so as a result of that, that client may end up with an injury. And if there's an injury that's directly caused by us not performing our duty, then that's negligence. Okay. So know the steps for if there is disciplinary actions. A complaint is filed to the state board. So someone calls it in. A facility may even send the information in. The complaint is reviewed. An investigation does have to take place. They may actually come down and do on-site. They may ask for interviews, written statements. They may even look at video footage. And then this is where the nurse has the opportunity to respond during the board proceedings. We need to know that the nurse responds during the board proceedings. Okay. Then the action has been determined. Is this a legitimate complaint? And if so, what is going to happen to that nurse? There might be license may be revoked or taken. There might be suspended. They may have limitations of practice. And what that means is that nurse might only be able to practice on a certain shift because they would need a certain level of supervisory. And then can be remediation. So if a person does have some type of disciplinary action, and years ago, that information was not kept up with. But now that information is kept in the National Practitioner Data Bank. It's like a huge file cabinet, so to speak. If someone has a disciplinary action on their record, their name and that disciplinary action is in this data bank. So the reason is what happened, if someone had a disciplinary action, they were able to leave that job and just go and work other places, and no one knew that they really shouldn't be working there, or at least were aware of that this person had disciplinary actions. So the nurses is another data bank where they verify your license. Like once you get your license, you'll go on to work, and you fill out the job application, you do the background check. They will also run your license and your name through this database just to ensure that you do have a license that's active and to see if you have any disciplinary actions. Okay, we talked about that practitioner data bank. Again, that data is a data management system to track unfit healthcare practitioners and restrict the ability of incompetent professionals to move from state to state without disclosure. So they were moving from state to state and working, and people didn't know that they were not made aware of. So all state board of nursing entities are mandated to report disciplinary actions, probation, suspensions, if license have been taken. Okay. So when they run the nurse's name through the database of nurses, of course, the name is there, the person's license number, the date that those licenses expire. They usually expire at least every other year. And then if there are any disciplinary actions. Your date of birth is not there. They don't need your address. They don't need your social security number. It's just your name, your license number. Everybody has their own license number. It's almost like a tag for your vehicle. Each vehicle has their own tag number, and it has an expiration date. But then in addition to that, if the nurse has any disciplinary actions, that will be listed there as well. Okay. So criminal government versus individual. You're talking about legal liability, felony or misdemeanor charge, crimes such as homicide, larceny, or embezzlement. So you're that nurse, you're working and you're helping with, payment. And then so in the midst of that, you get caught up in some type of moving money around illegally. We're writing down money's being used for something that's really not. That's criminal. So doing civil, individual versus individual. Because here, if the documentation is not there, what Medicaid can do or Medicare can do, what they do is, okay, for example, if a patient's at a long-term care facility, and if Medicare is paying for their stay, they look at the documentation to see what skilled care is being provided. If the documentation does not support that skilled care has been provided, Medicare and Medicaid government, they can pull that money back from that facility. They can have that facility to pay that money back because the documentation does not indicate that those services, those skilled services were provided. Okay, so civil, individual versus individual. And sometimes there is monetary compensation as a result of the findings. And here for civil, there's intentional torts or even unintentional torts. Harm came to someone, your patient, and you didn't intend to cause them any harm, but they did receive some type of harm. That's an unintentional tort. And intentional is what it is, harm was actually intended. So an intentional tort is the intended cause of harm to the patient, threat, actual, or physical harm. Unintentional tort did not mean to cause harm to the patient. I did not mean to hurt the client. Is no defense if you did not use, for example, the six rights, your rights to medication administration, the rights to delegation, all those things that are put in place. We need to take the time to actually do those things because it lessens the chance of someone receiving unintentional harm. Okay. Liability is being responsible for something. Liability in nursing is associated with civil law, and it includes contracts, negligence, intentional and unintentional torts. So we're liable. So think about that. Once you check in, you clock in for that day, you know, if it's your duty to take care of those patients, make sure you don't breach that duty. Provide the care that's listed on that care plan. If you don't, that's breaching the duty. If that client receives injuries or damages and they can prove that those damages are related to the nurse not doing what they were supposed to, then that equals negligence. So these four elements are needed to prove negligence. Well, was this my patient? If it was, what were you supposed to do? What actually happened? Were there any injuries? And was that injury directly related to the nurse doing what they were supposed to or even not doing what they were supposed to? This just goes over that again. Duty refers to the nurse's responsibility to provide care in an acceptable way. The nurse has a duty based on education as well as the policies and standards of the place that they work at, that they're employed by. Breach of duty means that the nurse did not adhere to the nursing standard of care. What was expected, what was not done, omission, or what was not done correctly. We administered the medications, they were supposed to receive them, but we did not administer them correctly at the correct times or the correct route. An expert nurse witness establishes standard of care. So someone will file a complaint, they'll go to a lawyer, and the lawyer will call this expert nurse witness in to look at the documentation. That's why it's so important to document. That expert nurse will look at the information that you have documented. And they will look at the standard of care. What should have been done? And they look at the documentation, compare it, and determine whether or not if there was a breach of duty or not. Okay, and we talked about the damages. These are injuries that the person has actually sustained. And then the proximate cause means that a reasonable cause and effect relationship can be shown. Is there a direct relationship shown because the nurse did not do what they were supposed to do? Whether it was not done at all, which is omission, or not done correctly, which is commission. Okay. So calling that expert nurse in. So we have battery and assault. Battery is to cause physical harm to someone. And then assault is unjustified attempt or threat to touch someone. So want to pause. Are there any questions before we move forward? Okay. So we do have different types of restraints. chemicals, also medications. Even the patient is prescribed a medication, medication that comes to mind is pain medication. Usually the pain medication, it, alters that perception of pain. And oftentimes people will get drowsy and those pain medications will, you know, help someone take a good nap. So if we are administering those medications just so that that client can go to sleep rather than that patient needing that medication because they're hurting, that is a chemical restraint. And physical restraints are an example of wrist restraints. Okay. Defamation, damages to one's character, can be through slander, which is spoken. Did someone say something to damage someone's character? Or did someone write something? That's libel. Libel is written, and then slander is spoken. Did they say something or did they write something to damage a person's character? And some examples of that is writing a letter in the editor in the newspaper, handing out flyers or pamphlets, and then posting on social media pictures and messages. Okay, let's look at the steps to bring on legal actions. The client believes that the nurse has violated his or her legal rights. They seek the advice of an attorney. They call the lawyer. The lawyer usually will get them to come in and get their information. Then that lawyer would have that nurse expert to come in, like we just mentioned, to look at what the standard of care is and measure that up against what the care that was actually provided. A determination is made by that nurse expert whether or not the standard of care has been violated or the standard of care was actually provided. Was it done or not done? If it was violated, if it was not done, a lawsuit is filed. The client, the plaintiff, files a complaint, and then that documents whatever that grievance or whatever that violation was, whatever they're saying that nurse did not do, whatever standard of care that was not followed. Example could be a person has sustained a decubitus ulcer. The standard of care is that a person does not, unless there are disease processes or some other indication as that person will be at high risk for that. But the norm is a person should not have a break in skin or decubitus ulcer. So the standard of care is no open areas on the skin. So the expert will look through the chart, the documentation, to see if this person has been turned every 2 hours. What was their nutrition? What were their lab works? What are their different diagnoses? Does anything show or can match or lead to this person having this opening area on their skin? If it does not, then a lawsuit is filed. Okay. And so the defendant can respond and should respond in writing. There's a discovery period. Pre-trial begins. Statements are taken from the defendant, that nurse expert, the client, which is also called the plaintiff, and any caregivers. The facility's policies and procedures are looked at. Because remember, the Nurse State Practice Act tells us those things that we can lawfully do. That facility creates their policies and procedures based on what we can lawfully do from the Nurse State Practice Act. Do they match? Did this facility have us providing care that was lawful and correct? During the trial, important information is presented to the judge or either the jury. A decision is made. A decision is called a verdict. The client or the plaintiff has the burden of proof. They have to show that evidence of something was done wrong during that trial. So an appeal is a request for another trial. And there's usually a monetary settlement if they have proven that, if they have the evidence that doings actually happened. So we do want to have our patient to take part in their care. It's their care. They're receiving the care. So we need to know what things that they value. We need to know about their cultural beliefs. And then we want to encourage them to participate in that plan of care through collaboration. How much do they know about the disease process? What is your understanding? What do you know of how to manage that disease process. So the American Hospital Association, they developed the Patient's Bill of Rights, which was revised and renamed the Patient Care Partnership, understanding expectations and rights and responsibilities. So it's a partnership with us and those people and the patients that we take care of. So we want to keep private information or clients' information private. We want to protect the privacy of our patients. So we want to be careful how we are discussing things, where we're discussing information at about our clients. If we're documenting on the computer, and most facilities have it where if you walking by, you can't see what that person's looking at on the screen because they can walk by and look and see the client's private information. And we do not want to violate HIPAA. Clients can file a complaint if they think that their privacy has been violated. So be careful, even the family members, be careful who that you're talking to and what you're talking to them about. HIPAA requires that all covered entities designate a privacy officer. So when you go to work at a healthcare facility, you might be that privacy officer. It would just be an additional task that you will have. The notice of privacy practices will provide information on how to contact the facility or the privacy officer to file that complaint in the event that they want to, if they think their privacy has been violated. Clients have a right to their medical records. Some facilities, up to a certain page number, they'll print them out and give them to them, but beyond a certain number, they'll ask them to pay a small fee. But nevertheless, if that client wants to come in and review their medical records, it is their record. Each facility determines the conditions their records can be reviewed. So the nurse will adhere to the minimum necessary rule to protect the client's privacy. Minimum necessary rule. So what information is needed? The example that they have here, they have a vendor. For example, a patient's going home, they're being discharged, and they need a hospital bed. They need a cane. They may need an oxygen concentrator. So that health equipment company will need to know who the information goes, the equipment goes to. They need to know that address and the payer source. How are they going to get paid for the equipment that they're delivering? They don't need to know date of birth, social security numbers. We only give the minimum information that's necessary. Okay. The client has the right to consent to or refuse treatment. That's part of their autonomy. They have the right to choose. They can refuse or decide to accept that treatment. Now, we do need to know all these parts of informed consent. So we just read through each one of them. Informed consent must be obtained for invasive procedures ordered for therapeutic or diagnostic purposes. Informed consent means that the client is told the following in a non-medical language, in a language and in words that they can understand. Because remember, we are healthcare professionals. We're going to school to learn all these different terms. So it must be in layman's terms, in plain words in English, or whatever their, whatever language they speak in. But the words must be non-medical so they can understand. What is the diagnosis or suspected diagnosis? What is the reason? Why do this person need this treatment? What is the description of it? What does this treatment entail? What is the expected outcome? If I get this treatment, am I supposed to feel better? Or am I, am I supposed to improve in walking? What is the expected outcome and benefit? Also, I need to know if there are going to be any side effects or complications. Okay. You want to explain, is there a different treatment? Are there any alternatives, or is this the only one? And if there are alternative treatments, what are the benefits, the side effects, and the complications of that alternative treatment also? They need to know the name and qualifications of the people who will perform the procedure. We have the doctors that's going to do the surgery. We have the anesthesiologist that's going to put you to sleep. And so, well, what's the name of the doctor? What's the name of the person that's going to put me to sleep? They need to know the name and the qualifications. the prognosis if the treatment is not done. If you don't get this treatment, if you refuse this treatment, the evidence shows that most people, whatever that evidence is, a prognosis for that treatment. And then you want to answer any questions to make sure that we provided clarification. Explanation that the client has the right to revoke written permission at any time. If they sign off on it, they give you permission. They're on the bed, the gurney, and we're headed down to surgery. Oh, I changed my mind. They have the right to change their mind or decline the right to revoke written permission at any time. Okay. So we have advanced directives, we have a living will, and a durable power of attorney. One of these documents designate a person. Right here, this healthcare proxy, this is a person. A durable medical power of attorney says, hey, I want my daughter, I want my niece, or I want this person to make these decisions. A living will does not specify a person, but the client's or the patient's wishes are written down. Both of these are legal documents. So the living will does not specify a person to make those healthcare decisions. A durable medical power of attorney, it does. A healthcare proxy, that's a proxy is just they designate a person. Just another word for a person that's been designated. So do not resuscitate order. It is a legal document. It is giving you the client's wishes. In the event that they need resuscitating, we do not. So even if a person does have a do not resuscitate order, we do not turn off ventilators. We do not stop treatment until the physician has pronounced the client deceased. Okay. If we turn off the ventilator or stop treatment, it is considered an act of murder, and it's illegal and also unethical. So we need to make sure when we're talking about life support, this person is a do not resuscitate. The patient must be pronounced dead by the physician before we stop and turn off and stop treatment. Okay. What are some unethical acts? Giving a client a higher than prescribed dose of pain medication. If that medication needs to be changed up or down, we need to let the healthcare provider know our assessment findings. They will need to give us an order. Accepting bribes, administering CPR to a client that's a do not resuscitate. Okay. We do have different styles of leadership. The laissez-faire, we're more concerned with the employee, not really the care that we're supposed to be providing, but just more concerned with our coworkers and and what they think, not the client care. Autocratic does not consider the employees. It's all about the task. Let's get this task done. If you're sick, it doesn't matter. Let's come in here and take care of these people. Democratic, there's a balance between the task and the employee. So these are just different leadership styles. So an assignment is the distribution of work that each person is responsible for during that given time frame. Delegation is the transfer of responsibility for performing an activity from one individual to another. So the nurse can delegate activities to an unlicensed personnel, but we are not relieved of that duty of making sure that task is complete just because we delegated it to the unlicensed personnel. So remember, before you delegate, the client must be assessed. Data should be gathered on their condition. Is this client stable or unstable? Because if that client is unstable, we're not going to delegate their care to unlicensed personnel. Okay? The unlicensed personnel cannot delegate to another person. Delegation, once accepted, cannot be transferred. Delegation, the delegatee might refuse. We need to ask. what is going on as the reason why they're refusing to take that task on. Now, these 5 things guide us in deciding or delegating correctly. So, what is the task or duty that we're trying to delegate? Is it the circumstances? Is this patient stable or unstable? Because even if it's a task that an unlicensed personnel can complete, if that client is unstable, we would not delegate it because that would not be the right circumstance. Is this the right person? What information or instructions or direction do we need to communicate and make sure that we're communicating effectively? What oversight, what supervision and evaluation um, is needed? Okay, so these are some tasks that an unlicensed personnel can complete. Feeding, transferring, weighing, measuring vital signs, catheter care. They can apply heat and cold. They can collect urine and stool specimens. They cannot complete sterile technique procedures. Nursing assistants do not have, or unlicensed personnel have not been trained on sterile technique. Crisis situations. An example of a crisis situation, if a resident develops chest pain, we are not going to delegate. Although nursing assistants can collect simple data, they have not been trained to make decisions about or to interpret the data. For example, if they measure the blood pressure, they cannot come back and say, well, hey, this blood pressure is high, the systolic number. No, they have not been trained to interpret the data just to complete the skill. Duties that are not part of your legal scope of practice may never be delegated. Things that you're not lawful to do, you can't delegate someone else to do that. Okay, we talked about this. What if delegation is refused? We need to just have a conversation and determine why that team member feels they're unqualified or they don't want to do that activity. And just a conversation to see what is going on. Okay, so change of shift. That gives that next nurse the baseline information. So when they go in to take care of that client, they can compare. It gives them that baseline. Okay. Things that we can do to increase our employment opportunities. We can get certifications. We can network, read books, attend and enroll in leadership courses. That certifications is a big thing. Okay, and that brings us to the end. Are there any questions about any of the concepts?
No, I don't have any questions. Thank you.
You're welcome. Make sure you place your name and campus your name, campus, and professor's name in the chat. I forgot to tell you all that. Just to make sure I'm recording when I say this. Make sure you go back through your classroom recordings for each week. Go back through your required readings and also view the exam reviews from the other professors. Take care and we'll see you soon.